for us, like we might see somebody that does have a lot of medical needs and their blood pressure is really high, and we really can't do anything till we send them to Clinic with a Heart for a, an evaluation. But
and again, like keeping people out of the ER. Like I think I might not have this statistic perfectly correct, but I think it was like 40% of our patients said they would have gone to the ER if not for Clinic with a Heart last year.
That's a huge percentage.
Yes.
Thank you guys both for coming on today to this episode of the Jazari Kual Show. Thank you guys for tuning in. If you are watching or listening wherever you get your favorite shows, I'm here with Dr. Farrah, who is a volunteer dentist at Clinic with a Heart, and Molly Oglesby, the Director of Development. Thank you guys so much for being on today.
Thanks for having us.
Yes.
On this rainy, gloomy day.
Yeah.
I don't know. I kind of like this weather.
It's beautiful in here. I love this whole atmosphere.
It's really cool. You've done a cool space.
Thank you. You've watched a lot of HGTV. And
it shows.
All right. Well, you guys volunteer and work at Clinic with a Heart. So for those who are not familiar with Clinic with a Heart, can you guys give us a little bit of a spiel on what you guys do and what services are offered?
Yep. So Clinic with a Heart has been around. We're in our 22nd year, and we offer healthcare to the uninsured and underinsured of our community at no cost. That includes medical, dental, vision, chiropractic, mental health, podiatry, diabetes care, hypertension clinic, physical therapy, all sorts of things.
Nice.
Yeah.
That's awesome.
Yeah.
So this is your 22nd year, you said?
Clinic's 22nd year. I've been there a little over a year. Yep. Okay. About a year and a half for me.
Okay.
Mm-hmm.
You just want to move the mic a little bit closer.
Yep. Like this?
Yeah.
Okay.
And what about you? How long have you been volunteering at Clinic?
So I've been in Lincoln in the volunteer world for about 7 or 8 years. And I am at People City Mission, Clinic with a Heart. I help with Mosaic.
Okay.
And so, like I was saying before, we have such an underserved community here that it really takes all of the resources of everybody to make this work. And Clinic with the Heart is the only free clinic in Lincoln right now. I mean, the People City Mission did have a free clinic for medical, and we do not have medical anymore.
Still have dental at the Mission.
Right.
Okay. So how has kind of the clinic evolved in its, 22 years? Did it always start with offering all these different services, or was it kind of just like a one and then building on from that?
Exactly that. So our founder, Dr. Rob Rhodes, was on a mission trip to Reynosa, Mexico, and doing medical services for the residents there. And then on his way home realized that we needed this help in our own backyard. And so it started as what we call a tote box mission. So people were literally taking totes of medical stuff to parking lots, churches, Center for People in Need, I believe is one that we used to use, and would go take care of people there. And then we've been in our current location on 17th and Sumner for 13 or 14 years. So now we've expanded a lot into offering all those services instead of it was just like, you have a cut or you have an ear infection or something going on. So we're going to help you right now.
Okay. All right. So kind of who are the people you guys serve? What's the most common medical need your patients are seeking at the clinic?
Most of our visits are medical. I mentioned a whole bunch of specialties that we do as well, but the bulk of them are medical, where it's, you're calling and you don't know what's wrong. You have stomach issues, or you have pain somewhere, or you have a sinus infection that won't go away, or anything like that. So that's the bulk of what we see.
Okay.
And then next would be dental. So there's a huge need for dental here.
So in kind of the dentistry realm, what is kind of the number one issues your patients usually are struggling with?
So sometimes I think that at the Mission in particular, people think we're seeing people from the shelter. Not that we do not, but I would say the most people we see are people that they're working poor. They can afford maybe their basic bills, maybe their kids are on Medicaid, but they can't get any services. They just can't pay for those kinds of services. So, and then I would also say, like, for us, I think the immigrant and migrant population, we are taking very good care of. And it just makes for a healthier Lincoln in general. We just had the Clinic with a Heart gala that we had in March.
Back in March.
And the keynote speaker said, think globally, but act locally. And, we want to keep everybody in the community healthy, not just those that have the means, because it's actually been proven, and she had statistics up there, that in Lancaster County, we have a longer age span. We live longer here.
Yeah.
We have less health problems because we actually do have some, the free clinic, and we have we have some places that people can go.
Sure.
And it has been proven that we are healthier here and we live longer. And I think that you have to look at the community as a whole and everybody that lives here.
Mm-hmm.
That's fascinating. I remember reading a study several years ago, and Lincoln we do have a huge life expectancy or long life expectancy here in this county, but then it can also vary depending on what side of town you're on as well.
For sure.
So like on the south side of town, like people have a longer life expectancy than people just a few miles the opposite direction.
Right.
Which is the most like mind-blowing thing. When I was reading that. So when you guys have refugee and immigrant populations come in seeking dental care, I mean, is that kind of like the first time that they've seen a dentist in the capacity that you guys, in the services that you guys offer? Or
for me, I would say that it would depend on the country that they're coming from. Because right now we're seeing a lot of Ukrainian refugees, and they're used to having socialized dental care. So, there's a lot of countries out there that are doing the work on people, but then say they come to the United States, a general practitioner honestly doesn't want to see them. They think like, well, we didn't do this work. This implant wasn't done by us.
Okay.
Where we're kind of like, we're never going to go like, we're not going to do this. Like we'll try to work in conjunction with the school or Dr. John Asbjornson. So we just have resources, I feel like, for those cases, because I was shocked. Like when patients would come to me and say like, I've tried to go to other offices, and they will just say, if you've had work done in other countries, we don't see you. Wow. Which is mind-boggling, right? Like, and then if I hadn't been told that, I'm just like, that's crazy.
Oh, wow. I did not know that was a thing.
It is.
So how does that work with like, say different countries. So like if you had dental work done in like North Carolina or South Dakota, or wherever the case may be, usually you can seek continuous care, right? Like, I mean.
And it's not as easy as you think. So like even in our Medicaid population, when we credential to be Medicaid providers, we're only credentialed in Nebraska. So like so I see patients in healthcare facilities as well. And so like the facility will have to get that reimbursement from the state of Missouri. And that's not always easy. Yeah, no. So there's a lot of things like that you don't really, when you're in just general practice, I don't really think you pick up on those things until you start to see a more diversified community of patients and realize how hard that is.
So then how does it work with patients who need care beyond your guys' services or continuous care?
So we have a position that's a referral coordinator. So basically you come to see us for whatever it is, ear infection, you bring your child there for some reason, and we will take care of you. We can get you a prescription that is also at no cost. And then if you need further services, we will refer you and do like a warm handoff to Blue Stem, or even Centerpoint has a primary care facility now, so you can go to Centerpoint. And those are sliding fee places, but I know Centerpoint won't turn people away for inability to pay.
And then what would you guys say kind of like is the biggest barrier then?
Language.
That's a big one. And we do have interpreters. So we have a bunch of volunteer interpreters. Last year we had 26 different languages spoken at the clinic.
26?
Clinic with the Heart kills it at interpreting. Like they save a lot of time because I'm on my phone.
Google Translate. Yeah.
I mean, I didn't even know this many languages existed 10 years ago. And so I would say the language barrier is tough, but Clinic with the Heart makes that a lot easier because they do have so many different interpreters.
Well, and we'll have people come in for medical care. And then if they're speaking a different language, we will say, hey, why don't you come back and volunteer and help your community? because if we've got somebody that coming in that speaks Pashto and we need, that's a big language.
That's a big need right now, especially since the U.S. pulled out of Afghanistan and a bunch of like refugees had come over.
Exactly.
And so that's been like a huge population.
That's a
influx.
huge population we see too.
Yeah. Oh, wow.
Yeah. So I think that that's difficult because I think that, but then at the other hand, they're so grateful for the care.
Yeah.
And I think that you're taking the time. It's just that I could obviously sit down and in 5 minutes talk to you about something that might take me like 15 minutes to really go over with them and show them pictures. And like,
especially when it comes with like medical stuff. Yeah.
Oh, for sure.
Medical terminology, right? Like figuring out how to explain that.
Right. I couldn't compare it to anything other than like my patients that are at the shelter, like for like domestic violence.
Mm-hmm.
So they come in and they're obviously timid and scared. Yeah. And I feel that a lot of my, especially female patients, like right now, the influx like of the Ukrainian women, and if they hear a noise, they're frightened. So just to put yourself down to a level of like,
that trauma,
that this is trauma invoking to begin with, you really have to be able to take that time with them. And, sometimes you might just meet with them and talk them through it, and then they'll come back and have the work done.
Oh my gosh. I used to be afraid of the dentist. I used to hate going to the dentist. And I remember specifically why, because we used to go to the College of Dentistry for free cleanings. And there was one time where I couldn't sit still. So they put something in my mouth to keep it open.
By block, you hated it.
Yeah.
No one likes it, just so you know.
Oh my gosh, that was awful. And then like, I didn't go back to the dentist for like a really long time.
Right.
And I was lucky to have like the kind of teeth I do. So I'm like, I should probably start taking this seriously. And then I had old fillings that were metal that started to deteriorate. And so I went to Lincoln Family Dentistry, and the way the dentist there described it to me, she was like, these metal fillings, like you've had them for 15 years. After a while, the bottom starts corroding and can create a whole new cavity.
Right.
And like over like 13 or 14 appointments, she like removed all the metal, replaced all the filling. I had a few crowns that she needed to do. It was like an extensive thing.
Well, yeah. And if you can imagine, like right now, if you get a crown in Lincoln right now, it's $1,500 minimum. I mean, if you don't go to the school, and that is like the minimum. Like, we pull a lot of teeth, and every time we pull a tooth, it's like if you went out to the general public, you're going to have to pay like $100 exam fee, $120 pano fee, and probably $200 to $300 for an extraction. I mean, you're looking at $500 to have like one tooth taken out.
Yeah.
That's crazy, right?
Yeah.
And I think that gone are the days a little bit of, when we were kids, your parents could take you to the dentist and pay $50 a month, right? Like that was just normal. Payment plans were totally normal. And now, unless an office would like give you care credit,
exactly,
then you can get a little bit of something like that. But I mean, back, when we were kids, it makes me think like, well, we probably would have been on Medicaid if there wouldn't have been those, that doctors did things like that, or dentists did things like that. It's just those days are gone.
I was thinking about this yesterday, and I'm just like, I have to go back for another crown. But like, I used to have dental insurance when I worked in corporate America, and then after I left, I don't have that insurance anymore. So like 95% of all the work that I described a little bit ago, like I had to pay out of pocket.
Yeah.
It's expensive. I
and
think
like upfront.
I need an implant, and I'm a dentist. Right. So like I got a kid in college. I still think $3,000-$4,000 like on one tooth, like, and
That's
then
insane.
to me, I think for $3,000-$4,000, I could get a lot of stuff done on somebody else. So I have that kind of, like.
Do you guys do that kind of stuff, like implants and stuff?
No, but we have a really good working relationship. Clinic with the Heart and People's City Mission has a good working relationship with the dental school. So like for us, and, like I said, if we are in a week, we definitely tell everybody that calls. Clinic with a Heart will do your evaluation on Tuesday. You have to go on Wednesday. And you do have to put the fear of God into some of these people a little bit, because we do not want cancellations and stuff like that. I mean, if we give you this appointment and whatever, we're going to need you to come.
Right.
Right. Like, I think that's what makes people not want to take Medicaid or not want to take some. They're like, and I feel like it works out, pretty good. But for us, I've had students now for 7-8 years. So I formed relationships with those students, and I can always get those students, and even Medicaid, right?
Mm-hmm.
If I didn't have the school, because sometimes I'll have somebody that has Medicaid, well, then I'm going to get them, into the dental school, and it's just easier for us to do it than for somebody to cold call the dental school. Yeah. And it shouldn't be that way, but it is.
Right.
Yeah, our dental appointments, our appointment books go week to week. So if you call Monday morning, you can make an appointment for that same week. Mm-hmm. So people start calling Monday morning at 9 when the phone's open, and they're full within 30 minutes for the week, every week. And there's a wait list. And all we do for dental at the clinic is extractions. So pulling teeth, and then, anything else we refer out to City Mission or elsewhere.
Which I think is super cool about the capital campaign, and like with Clinic with a Heart expanding. Mm-hmm. And I can't speak upon what all was included in that, but we're trying to all work together. And we've had meetings at the dental school with the new dean, and Dean Kugel and his assistant dean, Dr. Farr, they definitely want to help this community too, which is different than past. I definitely think that they know that. I've heard it said that Nebraska is like having third world dentistry, because if you are not somebody of means, it is nearly impossible. Mm-hmm. Like I said, if you're only working with 1 free medical clinic and 2 free dental clinics,
there's way too much demand.
There's way too much demand. So we're pulling all these teeth, getting people out of pain, hopefully keeping them out of the emergency room. The goal is also to save money. And I think sometimes for the taxpayer, they're like, how is this saving money? And all I would need to do is sit with them and go over the numbers.
Yeah.
Because the ER visits are atrociously expensive.
Yeah.
So, and then we don't have dentists typically that are working in the ERs. So they're going to give you some penicillin or amoxicillin and maybe 5 pain medications and tell you to see your dentist. Well, they don't have a dentist. Like, who are they going to see?
How does that work? So let's say if somebody comes in, a baseball hits them in the mouth, shatters some of their teeth.
We do have oral surgeons, like Dr. Henry Mitchell would come in for something like that.
Okay,
Dr.
So like
Burgess.
Okay.
So we do have things for emergencies like that, but most of this is just infected teeth. And some of these are just repeat, right? They've already been there several times for that same tooth, but there's nobody in the ER that can take that tooth out. I think that will be the progression of medicine in the future, because even right now we're doing checks on veterans when I don't know why the VA is not particularly doing those. Like, somebody will go in and get a knee, right? And their doctor says, well, you have to have a dental checkup first. And yet the program has nobody to send them to. So we do a lot of sign-offs on, okay, you're okay to have a knee surgery. You're okay to,
Isn't it like a whole VA hospital?
Yeah, but like, that's what I'm saying. Like, it's just,
I don't know if it's hard to get in there or what the situation is, because we see a lot of veterans as well.
Right. Oh, wow. And the school's doing a big thing with veterans right now. They are actually like one of the first state in the country to get like an accreditation to work with the VA directly. And they are seeing veterans on Friday afternoons, and that's just getting expanded. And what we're trying to do is get these people into dentures and partials, because really for us, it's pretty easy to take the teeth out, but to replace them is really hard. So in the capital campaign, we have a kind of a push to at least all of us to work together and work with the students to start scanning these patients after the teeth are taken out and getting them dentures, because we're all way behind on dentures. You just can't make them fast enough. It's not as easy as people think.
Well, and people can't afford it. So, we've got patients that come in and get 10 teeth pulled, and then they're down 10 teeth, and we're not providing them dentures. So we are moving into a new clinic, doing a capital campaign here shortly, kind of now, to ramp that up and expand our services. So we're hoping to be able to offer dentures, working with the college.
Tell me about the capital campaign and kind of the expansion of the clinic.
Yep. So we have been at our current location, like I said, 13, 14 years. And it's just not a super efficient space for us.
Okay.
We're in the Sowers building. It's great, but we're on 2 different floors. So like you come in for an appointment, we're like, okay, go in this door and then go in this one. And then you're kind of running around.
Not a very user-friendly space.
Yeah.
Yeah.
And it's an old building. And so I don't know if you've heard of the Center Terrace project, which is at 13th and E. It's the old Center Point location before they rebuilt over on 11th and South. And it's the Hoppy Development is putting together this project. And so we had an ARPA grant that is basically paying for our rent for the next 20 years. So Clinic with a Heart will be on the first floor, and then there will be 3 levels of mixed income housing on top of us.
Okay.
So it's going to be incredible. So we'll be right at 13th and E, like deeper into the neighborhood that we serve.
Yeah.
So I get to raise $1.3 million this year.
That's what I was going to ask. $1.3 million.
Yeah, which is pretty small for a capital campaign.
I actually think it is also very doable, especially because of the support we've had within the city. And yeah.
Could you guys receive like state and federal grants for something like that?
We don't get any state or federal money.
We don't either.
So it's all privately funded.
Donors and grants.
Okay, yeah.
Which was helpful to us here in the last so many months because, like we are also, we call Lutheran Family Services a lot, for different things. And, some of them, they were relying on that, relying on that money. And we're not really in that exact same situation.
Yeah, we haven't had any funding pulled from us because of that. So
how does that work? Okay, so you guys are all volunteer based. I do have questions about like how the volunteering works at Clinic with a Heart, but what is the operational cost to keep the clinic running? I mean, like medical supplies, things like that. Like, what are your guys' yearly expenses?
So I don't know exactly what it is, but I'm going to say between $300,000 and $400,000.
Okay.
It might be higher than that. I have been there about 18 months. And this is my first nonprofit role. I was in insurance before that for 26 years and got laid off. Oh, wow. So I love where I'm at, but I am learning a lot. So I think it's somewhere around there.
I'd say that's probably pretty close.
Yep.
And dental's expensive. Like we have a lot of overhead, like that, medical, I was saying, to get a medical doctor to come in and do like student exams and stuff, like they're not hunched over and like, they don't need drills and, we just require a lot of, if somebody donates to us like a chair and a setup, and that's $50,000. Like
$50,000 for the dental chair?
For the chair and then the unit that comes off of it. So we had 3 donated this year. And that just right away, you're like, well, that's a down
payment on a house. That's like a lot of money.
It is
right.
Insane.
Yeah. And so then you also realize that these younger dentists, which we're trying with the students always like to promote this, pay this forward when you're done. And we realize that you're going to be in a lot of debt and we realize like all of these things. But at the same time, I do not think that you ever lose anything by giving back.
Right.
And I've done it for 25 years and so far it has worked for me. So I really do think that, and I think it's always really good to get people that have been in the dental business or the medical business and kind of know the ins and outs of the business part of it. So then we can take what we had in private practice and go, we can do this more efficiently on the nonprofit level and make this, try to bring some of these costs down, try to be, have a good team together and try to be more efficient because we know we have to be conscious of the money.
You said like if you have a patient come in and, they speak Pashto, but they can, they're conversational in English and can, help translate that kind of stuff. What kind of training do volunteers like go through to be able to like serve at the clinic then?
Yep. So most of our volunteers, we've got, I think, over 400 volunteers right now on our books. Most of our volunteers do have to have some sort of medical license. Okay. All of our doctors, nurses, dentists are trained professionals. So they're coming in and volunteering their time. We have 5 full-time staff. So executive director, myself, director of clinic operations, volunteer coordinator, communications coordinator. And then everybody else there's some part-time people and then everybody else is volunteers. Okay. So we do have volunteer interpreters. We've got a lot of students coming in. that are getting hours that way through volunteering to, learn more and put their hands on in the clinic and that kind of thing. But yeah, so there's training depending on what role they are doing. If it's a non-clinical role that they're doing, so if a lay person wants to come in and volunteer, there's a few roles that we can put them in, but there's not very many. So we can't offer, let's say some organization wants to come in and volunteer for a day. We really don't have the room for people to come in and do that unless they have medical background.
Okay. All right. But like the volunteer base, do you guys, as far as like translation,
yes,
do you guys work with like a translating service, or is that kind of just directly with you guys? Like
it's just word of mouth. So that's what I'm saying is we've got, if somebody comes in as a patient, then we will most likely turn around and ask them to also volunteer. Yeah. So that's how we've gotten, I think, probably the bulk of our interpreter volunteers is by them coming in to see us, or, we're at an event and we notice them speaking a different language, or they're part of this organization or this group or something, and then we'll ask them to come help us out and help out their community.
Are there any like impactful volunteer stories that you could highlight?
I have one.
Okay.
So we had a patient that came into the free clinic several years ago, and she was just really good, like with the patients, like just a genuine, like good-hearted person, always treated everybody with, just like respect. And she was looking to get, she had been like bartending, waitressing, things like that. And we were like, we need to work with her. Like she has skill sets that we can work with. And now she has a part-time position at Clinic with a Heart.
Oh, wow.
And then one of our dental students that'll start dental school this fall is working at Clinic with a Heart too. So it really is the connections that you make with people, and those people that get services, they really do want to pay. They do really want to give that back.
Mm-hmm.
They're very grateful, and they're very trusting for being in such an unknown place with people that aren't speaking. But I think that if you get into this work, you're definitely somebody that is empathetic to those situations. Yeah. And I think they can just feel that from you, like pretty much right off, right out of the bat. But I love the idea of like, if we have somebody come out of like St. Monica's, we can train them to be dental assistants. And if they really like it, there's a lot of dental assisting jobs out there that, pay really well. And, like that was not something I ever thought of when I went down there. I just thought, I'll help some people with their teeth. And then it's like I've met people from all over the world that I did not meet while I was in 8 years of college.
Right.
Wow.
Right. Different perspective on that. And then that we can actually take some of these people and go, like say they have to do some probation, right? And they're doing volunteer hours. Well, and they're really good at answering the phone and all that. Well, they can volunteer with us, and then we can write them a letter of recommendation and say, what I mean? Sometimes that's a huge thing for, that's a huge thing for people. If you have somebody that comes in and they've been convicted with a felony, they can't get an apartment, they can't get a job. But if they can have a couple of people vouch for them, it does make a huge difference.
Mm-hmm.
Well, I mean, you could be president of the United States.
Clearly. Love it.
So what is kind of bouncing off that topic, I guess a little bit, there's been a lot of like concern of it's already difficult because I know people who have Medicaid and it's already difficult to get services with that. What are your guys' thoughts on like if Medicaid or Medicare is cut and there's like a decrease in, that being offered? What are some things that you guys anticipate happening?
I mean, I think the demand for our services will go up because we don't take Medicaid, we don't take insurance, we don't take any sort of payments whatsoever. So there's no money exchanging hands at the clinic. And I feel like, some of the people that are able to use Medicaid right now, if they don't have that option, where are they going to go?
Especially for dental. Yep. Because most medical providers, you're going to be able to find somebody. You can go to the ER if you have Medicaid.
Yeah.
But I actually, when I'm not volunteering, work with the special needs community. So most of my patients are on Medicaid. And it, in 20 plus years, this is the hardest I've ever, I mean, when I graduated, almost all of us signed up to be Medicaid providers, right? And now, of my classmates that live in Nebraska, I have one that works at a public health clinic, so she takes it, a private dentist in Plattsmouth that will see kids. But I will get, as Molly knows, I had a mom that like felt terrible that her kid like had always went to the dentist in McCook, and then the dentist said like, oh, his 6-year molar needs a root canal, and that's going to be $1,300. And so we actually worked something out, and they came to Lincoln, and we got that done for them. So, you know, that's just a hard thing to imagine, right? Like you're presented with like your 10-year-old kid, and it's like, that's a lot of money, and it's a permanent tooth. It's just, and so like, and Medicaid is, I don't even see how we could cut it any more than it's been cut. Yeah. And then the Medicare thing is just as much because, you know, I have patients that are on trachs. They are never leaving their healthcare facilities, and their dental care is really important. I mean, you know, if you're on a trach like that, like you're building up all kinds of stuff in your mouth. I mean, it's just, if you think about those patients, they're going to be harder to clean their teeth anyhow, because I work at Beatrice State Developmental Facility as well. You know, and
you're
so
all over the place.
I'm kind of all over the place.
She is.
But, you know, those places rely on Medicaid. And I would hope that those those most vulnerable are still taken care of. But my husband works with me, and there is never a week that doesn't go by that we don't get at least 5 messages from people that are looking for a Medicaid provider. So we can handle it in the facilities, but outside, just in this general population, if the school wasn't here, I'm not sure who would absorb all the Medicaid. And I don't really see how the cuts are going to do anything but raise the costs, because the people, like I said, they'll just go to the ER.
And that's been like a huge thing. Like people have started using the ER as just their form of insurance or whatever they need to do. Like, I mean, I mentioned like if I have a problem, I just go to the ER and like,
And
just
that's
wait
the
for them to
thing
send me
is
a
like
bill.
People don't know that clinic exists. I mean, I lived in Lincoln essentially my whole life, and so I know a lot of people. And a lot of people that I ask since I started this job, they've never even heard of us. So I don't know if you knew about us.
I did not.
So like you could come to the clinic because you don't have insurance.
Yeah.
So you just have to make an appointment.
So what do you guys do as far as like community engagement to kind of get out there more? Like, what does that look like?
Yep. So we've been doing a lot more of that. I would say since Nancy started as executive director, she's been there a little bit over 2 years. And it sounds like prior to that, we were just kind of staying afloat. There's so much work to be done. Everybody's just concentrating on taking care of the people, doing what they need to do, and less about community engagement. So we're really trying to ramp that up on social media. We've got Instagram and Facebook that Joanna is running, and then doing all the events. So school resource fairs, Give to Lincoln Day. We did not get a booth this year. It's first come, first serve, and there's 500 nonprofits in Lincoln and 60 spots. So
oh my goodness.
We had a booth down there last year. We did not get in this year, but we still went down there and walked around and talked to people and handed out postcards. And again, with this capital campaign, that's going to really help with exposure as well.
Well, and I try to get out, there's, Kelly's a friend of mine, Kelly Ross from Echo Collective.
Yeah, right next door.
I think she's a Disney princess. But when you start to make those little connections, or, I'll go talk at Fresh Start because these ladies are just trying to get their lives together. And I want them to know about Clinic with a Heart and the mission. And, I want to just get out there. You're going to have some trouble navigating this. And if you do, at least if you call Clinic with a Heart or call us, we can try to lead you in the right direction, because I've honestly cold called for a certain Medicaid. There's three different insurance companies.
Mhm.
I cold called one day and 42 offices wouldn't see me as a new patient. Now, I didn't say who I was or nothing like that, right?
Wow.
But so I think that when we work together, we can get more done.
Absolutely.
Because I can call a dentist and say, I'm going to need a little favor here, right? And we have some really good dentists out there in the community that are helping us out.
Yeah. So when you guys get your new facility and all of that kind of stuff, how much is there like a percentage you guys have estimated that you guys will be able to increase the services offered?
Yep. So we're saying about 30%. So right now we have 5 medical exam rooms and 5 dental rooms.
Yeah, 5 or 6.
We're going to have 8 medical rooms. Same
Okay.
for dental, but again, it will all be in the same location. The flow will be easier. Everything's going to be, it's just going to work much better.
I think it'll be much more handicap accessible.
Yep.
I mean, the whole thing is you really have to, 20, 25 years ago, you didn't have to abide by, some of these, ADA rules. You could be kind of grandfathered into them.
Mhm.
And then my sister was at Madonna for a year and a half, about 13 years ago. I busted open every door at my office, redid the handicap ramp, because once you are in that
get it.
that family of somebody that needs those, and then a lot of those patients, they feel, whether, people that are coming out of treatment, coming out of jail, coming out of prison, coming out of, just unfortunate, just life situations.
Yeah.
They are not comfortable going to normal dentists. They feel judged. And when they come to us, it's like, well, we didn't even know people were this nice.
Mhm.
You know what I mean? And they're so nice that you're like, well, no, anyone would not be nice to you, but they feel judged. And so I think that also holds space, the nonprofit communities, Clinic with a Heart, People City Mission, because you're not going to find that judgment at these places.
Right.
There's not going to be anybody. If we're volunteering there, we're volunteering because we want to help a certain segment of the population.
Yeah.
So there's definitely very little judgment going on. And I think most people are very self-conscious about their teeth anyhow.
Yeah.
Teeth are tricky. And, we see I have certain patients that have come in and we've taken their teeth out, given them dentures, and now they have a job. And like I said, there's just this whole,
Oh, wow.
Blow up.
We can really,
Yeah.
yes. So, and I think a lot of it is they feel they've been kicked to the ground and nobody really wants to help them. So when they have somebody that is knowingly and wants to help them, and then maybe will help them with other things, I think it goes on to make them better human beings and to help people too. And that's why we get volunteers our patients end up being our volunteers.
Wow, that's very beautiful.
Yeah, it's awesome.
Yeah,
it's
we did
unbelievable.
Yep. We did have, you asked about a volunteer story, and I just remembered when you said that. We had one woman that came in, I think she was from Nigeria, and she came in as a patient, and then she ended up volunteering for us for a long time, and now she has a job, and she was an OBGYN back in her home country.
That is something else too. You'll meet a lot of people educated in other countries that, could be doctors, dentists, and they can't do that here.
Yep.
Why is that? I've always wondered.
Well, I will say from our end of it, at least from at the dental school, that is, we would like to work more with those dentists and get them through the process of taking boards and being licensed in the state, and make that a much quicker, more accessible option.
Yeah.
But we get a lot of hold up as far as getting their dental licenses approved. It takes time.
It's just the red tape of the state.
I would say it's bureaucracy.
Yeah.
It's just the bureaucracy of it all.
That's always fascinating. I've heard of that, like people who are doctors or medical professionals in other countries, and then they come here and have to do something completely different or restart their lives in a completely different way. But we need as many OBGYNs as possible, especially with just everything going on.
For sure.
So, yeah.
Yep.
Are those services you guys offer too?
I mean, we can't do like prenatal care ongoing because we can't be a primary care provider.
Yeah,
we can't be like a medical home for somebody.
Right.
So if somebody wants to come in and get a pregnancy test, sure. But then we're going to refer you to, say, Every Woman Matters or another organization like that will be able to continue to help them throughout their pregnancy.
And it's just much easier, like, for us to call and get those referrals out because it's really difficult for, like I said, I cold called 42 places. But, you know, if I pick up the phone or Molly picks up the phone or Pat, you know, like we can make that happen just through our community involvement and the connections we make in the community. Because there's going to be a certain amount of dentists that are never going to come down and volunteer because they like to have their 2 assistants handing them everything they need and everything is everywhere it needs to be. It doesn't quite go like that you know what I mean? Yeah. So, but they're going to say like, we'll donate, say somebody needs 4 wisdom teeth out under general anesthesia, and they'll say, we'll do 1 a quarter for you. Okay. You know what I mean? So there are dentists out in the community that are definitely helping us along the way. Yeah.
Yep. So there's a lot of collaboration, I would say.
I would say that's the hugest thing of all of it. Like, you know, even with Friendship Home was just a Clinic with the Heart, you know, we make these connections to hopefully help people so that when they're ready to, you know, they're getting their lives back in order, they don't feel so overwhelmed by the processes that are going to help them get better.
So kind of the last question I had, you guys talked about a lot of collaboration amongst, you know, medical professionals, nonprofits, things like that, to help the population be served. What do you guys think like the city and state should be doing to help those who are falling through the cracks? Because I mean, like that's a huge amount of resources and stuff, but you guys don't receive any kind of grant funding or things like that. I mean, are there other ways that help could be provided or assistance be provided? Or does it all come down to cash?
I mean, it kind of does. Yeah. And maybe I say that because that's my job as development director is raising the funds. But I mean, the more money that we raise, the more services we can provide, the more, and you know, the more exposure we can get, we can advertise, we can update our website, we can do all these things. I don't know.
I would just say like when you're in the nonprofit part of it, there is just not so much outsourcing, middle management. You're saving a lot of money because now like with an insurance company, even if it's Medicaid, you're going to send your claim to one place. You're going to get paid by another. I mean, they are all outsourced. Like,
and every person that touches it gets paid.
And every person that touches it gets paid. So there's a lot of wasteful spending in that arena. And I wish I had like the answers for it. Nebraska is a small state, and we used to run dental and possibly medical. I mean, the first 15 years that I was in practice, we submitted all of our claims to the state of Nebraska. There was no outsourcing to insurance companies.
Oh, wow.
And now everything is an outsource. And then the insurance companies, then they third party their billing, they third party their claims. And so unless we could get some sort of handle on that spider web of where the money's going, less and less is being given to the patient and more is giving to the different entities involved.
The other thing I would say is just exposure, because I know that Nancy and Joanna went down to our new area where the new clinic is being built and just walked around and were handing out information to the local businesses right around there and just people on the streets. And people didn't know anything about us. And we're literally like, 12 blocks from there. And there were people like, wow, there's a free clinic? I had no idea. And we're like, yeah, we're going to be right here in your neighborhood. So that's part of it too, is just telling people. And Molly and I go to a lot
of things with small business owners. And we always want to tell them, if you have somebody that works for you and on a Monday, they are like, I'm going to miss work because my tooth is hurting, call one of us because you don't need somebody out for the whole week. We can help you with this.
Yeah.
Like, because
you don't need to go to the ER.
It really does. Because if you're in a higher position job, you probably have insurance and you probably have a dentist that you can call. But there is a lot of people out there working right now that, like I said, they cannot pay $400, $500, have a tooth taken out. And all these things are really easily managed by us. I mean, we can manage those things very easily. And that's the number one. I mean, we don't want kids missing school. We don't want adults missing work. We don't want, for us, like we might see somebody that does have a lot of medical needs and their blood pressure is really high and we really can't do anything till we send them to Clinic with a Heart for an evaluation. But I think for those smaller businesses in Lincoln, they definitely need to be paying attention to this because you want your employees as healthy as they, can be.
Well, and again, like keeping people out of the ER. Like I think I might not have this statistic perfectly correct, but I think it was like 40% of our patients said they would have gone to the ER if not for Clinic with the Heart last year.
That's a huge percentage.
Yes.
Oh, wow.
Yeah. So, and I mean, that's a burden on the community when people are going to the ER and then they can't pay for it. So they should come to us before the problem gets so bad.
And I think that's something we really, really need to educate, like the taxpayer on and everything, because there is a group of people that does not want anyone to get anything for free. But in providing these resources for free, we are actually saving the taxpayer a lot of money because they are not going to the ER. And like I said, we don't have so much bureaucracy and middle management and, that we can actually get, we get stuff done.
We do what we want. I do want to say one thing I did not mention that we do is school physicals. So right now, during the summer, over the summer, we have 5, I believe, clinic days dedicated to school physicals because if you're going to go to Lincoln Public Schools, you have to have a physical. And like we had a woman come in last year with her 4 kids. They had just moved to town. She did not have insurance. It was going to cost her over $1,000.
For physicals?
For 4 kids.
For 4 kids.
Yeah.
So when I think of physical, I think of like you want to play a sport and you have to go do like...
That's a sports physical.
Okay.
Yep.
So this
Same
is much
thing.
yeah.
I mean, they're still just checking you over to make sure you're healthy, checking your eyes, checking your teeth.
Yeah. It's so funny because last summer, my husband had cancer. And we were at doctor's appointments. I know, but we were at doctor's appointments all the time. And then I'm getting this email that like Ella has to have her vaccines and like her school check, right, for 7th grade. So I'm like, Molly, Ella's going to need to come to Clinic with a Heart for this. And I like no shame in it. That's why like we tell people like life gets crazy. Like we're not here to judge anybody that's coming in for anything. I mean, we have people that have some stories and somebody could go, oh, well, she should have. My life was crazy. Yep. It was just the most logical, easiest thing for us to do. And there's a lot of us that are like, like I said, we don't, if you need to be here, come. Right. It's like, you know what I mean?
There's
like,
no judgment.
You have people that are working like at U-Stop and places like this, and they have dental insurance. But I mean, they can't afford it to get anything done because it's like a $1,500 deductible. And like, it just, you know what I mean? There's just, and life is just life sometimes. And you need these resources to go, okay, I need help with this. Yeah. And that's fine. That is what they are there for.
Well, how can people find out more about you guys? Just on your website? Is it clinicwithaheart.org?
It is clinicwithaheart.org. Please follow our Facebook page. It's Clinic with a Heart LNK. We did have 2 Facebook pages, so we need people to follow the new one because we can't get into the old one. They don't make that easy to get into the old one if you're locked out. Instagram, and
How do people contribute to the Capitol campaign?
They can send us a check. They can donate on our website. Okay. They can call me and I will meet them, whatever it takes. So yes, that would be amazing.
To the community, we are going to be out there. Yeah. I'm going to be at every dentist office in town. I already got ideas for that. I'm going to take them candy hearts. And, sometimes it's just like, I think there's a lot of medical professionals in town that would be happy to give that money. Right? I'm not sure some of them know. I don't know if they know what we do. And I think that they know that we're helping, the ones that know, and they're very appreciative of it. So I really do think with this capital campaign, because we do have a large medical community, which extends to counseling. This is dentists, counselors, medical doctors. We have some really great sponsors at Clinic with a Heart, Brian and some, but I think that I'm kind of a grassroots person, and I'm like, you have a lot of people that will say, I think for that $100, that's really well spent. Mm-hmm. And it just prevents them from trying to go to their office and even bothering their receptionist with something they can't help with.
Yeah.
So everything helps, everything counts. We appreciate it very much.
All right. Well, anything else you guys would like to share? I think we're out of time, but.
No, I just think that I really do think that there's just a very neglected population of people in the state, in the country, and without these programs, I think it makes everybody less healthy.
Yep. It's true. It's a fact.
It's just a fact.
Yep. So thank you for helping us get the word out. We appreciate you.
Yes. Yeah. I would like for you guys to come back afterward and see how things progress.
Can we do like a podcast on the run where you could come down to Clinic with a Heart? Like when we open up the new one and be like,
that'd
hey,
be cool. Yeah.
That'd be awesome because,
awesome.
We were saying too, you have a different audience than some of, it's just, we need to get it out there to the people that's why having the connection with Kelly is wonderful because, how would I, this is for a kid that grows up in a town of 2,000 people, you have to be part of this larger community, right? Sure. You cannot just focus on, this is the church I go to. Right. This is you have to get yourself, out there into every demographic. Because like you said, I'm on the south side of town. My neighbors don't need any help. I'll sure take their money to help.
Yeah.
Right?
Please do, Farrah. Thank you.
Well, thank you guys. I will definitely come by your clinic and do
that'll be awesome. I think.
Really fun, yeah. Next on the Jazari Kual Show, Jaden Speed joins me to talk about his run for the Nebraska legislature, the issues driving his campaign, and what it means to bring a new generation of leadership to the State House. What message do you have to people who say I like you, I like your policies, I think you're a good candidate, maybe just not right now? Why don't you work your way up a little bit more and work on probably the school board or more campaigns and get more experience, right? What do you have to say to people who might think that?
Yeah. So when I was 13 and I was testifying at the legislature, it was sometimes odd to see a 13-year-old sitting at the committee table and talking to senators about this legislation, about the intricacies of bills. And for some people, it might be kind of odd to see a 20-year-old running for the state legislature. Mm-hmm. To some folks, that might be a liability, but to me, I think it's really an asset to have a young person to be the first Gen Z candidate running for the state legislature in Nebraska. I think young people have a lot of energy. We have a lot of passion. And I think those are assets for us. Yeah. And I think bringing that different perspective, that different worldview to the state legislature is something we desperately need in Nebraska right now. As you know, we have this problem of brain drain. We're losing young people. We're losing educated young people, especially, to go work and live in other states. We need folks in the state legislature that really understand where young people are coming from, that can retain young people in Nebraska, especially in our rural communities.
From policy priorities to the vision of Nebraska's future, this is a conversation you won't want to miss.